When we had our sonogram at about 35 weeks, they noticed something wasn't right with her heart. Baby's heart was quite enlarged and her heart rate was reaching up to 300 beats per minute. We just wanted answers. So once we got over to Cook Children's, it was really great to meet Dr. Roden.
I met Lake and her family before Lake was even born. And we did a fetal ultrasound and I talked to her about the diagnosis.
Lake had Ebstein's anomaly, which is a fairly rare congenital heart defect, and she was on the severe side. 2 weeks after we found out about Lake's diagnosis, we went in for a cesarean, and the Cook Children's NICU team was waiting in there with us. The neatest part was hearing her cry. She let out one little cry, and then they scooped her up and they ventilated her, and they wheeled her by me and got to see her, and then she and my husband, they went over to Cook Children's. After about 2 days of her life, Dr. Tam, who is her guardian angel here, was able to perform the Stearns procedure and shrink her heart down a little bit so it wasn't so enlarged. Cook Children's saved her.
8 out of 1,000 babies are born with congenital heart disease. It's very prevalent. I have been doing the fetal echoes at Cook Children for about 15 years. People always think an echocardiogram is an entirely different test. They all are ultrasounds. It's just that an echo changes the ultrasound a little bit so that it's better for the heart.
Cook Children saw the need for the fetal program because we consider them a patient and there's interventions that can be done while they're still in mommy's tummy. When the OBGYN screens the mom with their sonograms, they may see an abnormal defect in the child, or mom may have an issue such as uncontrolled blood sugars. If she herself had heart disease, if she had a child born with heart disease, sometimes we get to send them on their way and say, everything's wonderful, your baby looks great, and we wish you well. If their baby's not okay, what heart defect they have, what we see now, and what the potential is for when they're born and what we can do for them.
I think fetal ultrasounds give family time to think, time to accept, understand, and to make plans for their future.
We had a completely different birth plan in mind, and my fear is that had we gone through with our original birth plan and never had this fetal echo, that Lake wouldn't be here with us today.
When you're expecting a normal baby and you have only your obstetrician in the delivery room and you think that everything is fine and things aren't, it takes longer to mobilize the team. 30 minutes, that hour, if you don't intervene on them quickly, they can suffer lifetime complications from it.
The second she was born, she had a team of experts there to save her, and they did. We are expecting baby number 5. This is the first baby after Lake, and we are grateful that we are able to have a fetal echo done on this baby to make sure that everything looks great and that everything's well. I'm grateful for Cook Children's.
Lake is a normal little girl who runs around and plays. She is doing great. Life goes on. These are normal kids who are going to live their lives, and it's a little bit different than what people first thought it was going to be, but it's a pretty good life.